Aortic stenosis is a very common valvular disorder in our community. So it is very important that you possess a practical, useful clinical knowledge on the assessment and the management of aortic stenosis. Aortic stenosis is common amongst the elderly as a degenerative process. A calcific aortic sclerosis can progress into aortic stenosis. Now, aortic stenosis may remain asymptomatic for a long period of time and be incidentally diagnosed on clinical examination for some other reason. You will be able to hear a ascending systolic ejection systolic murmur in the physical examination, particularly in the aortic area, which is the second intercostal space in the sternal border on the right side. In addition to that, you may be able to appreciate a slow rising pulse in advanced aortic stenosis in the physical examination. The murmur of aortic stenosis can be heard radiating to the carotid arteries in both sides. Now, management of aortic stenosis depends on the clinical status and the physical area of the remaining aortic orifice, as well as the pressure gradient across the aortic valve. Now, what are the symptoms of aortic stenosis? The symptoms of aortic stenosis include angina, syncope, and sudden cardiac death. So therefore, any patient who has symptomatic aortic stenosis require treatment. The physiological parameters that would warrant treatment include a aortic valve area of less than 0.75 square centimeters, 0.75 square centimeters. If it is less than that, that is severe critical aortic stenosis that puts the patient's life at danger. Significant aortic stenosis is when the aortic area is less than 1 square centimeters. The usual or normal cross-sectional area of the aortic valve is 3 to 4 square centimeters. So as you can appreciate, it has to be critically narrowed for it to be symptomatic and significantly life-threatening. Now, if the patient has a aortic valve gradient, a pressure gradient across the valve of more than 75 millimeters mercury at peak, which is also called the peak gradient, it is considered critical, warranting therapy. If it is more than 50 millimeters mercury, it is significant. If the mean gradient is more than 50 millimeters mercury, once again it is considered critical and significant, requiring interventional therapy. So the criteria for treatment of aortic valve stenosis are symptoms, as I described earlier: angina, syncope, or sudden cardiac death resuscitated. Or if the patient has a critical aortic stenosis by way of area measurement across the aortic valve, cross-sectional area of less than 0.75 square centimeters, or if the pressure gradient at peak of more than 75 millimeters mercury, or mean pressure gradient across the valve of 50 millimeters mercury. The pressure gradient can be estimated by doing Doppler echocardiography, or it can be objectively assessed by catheterization of the left heart and measuring the pressure within the left ventricle and in the ascending aorta and applying those measurements to a mathematical formula. Now, what are the treatment modalities available for aortic stenosis? Critically ill patients who cannot withstand open heart surgery should be treated with what we call balloon valvuloplasty. Now, balloon valvuloplasty involves opening up a balloon that is placed across the aortic valve and cracking open this calcific mass. That will give you temporary resolution of the stenosis, but it will recur over time. The permanent solution is aortic valve replacement. The patient has to be able to withstand open heart surgery on cardiac bypass. Now, if the patient is critically unwell, a novel therapeutic modality is available, which is replacement of the aortic valve by catheterization. The patient has to undergo general anesthesia, however, does not need open heart surgery. So therefore, people who cannot tolerate open heart surgery can be given that option. Now, prior to surgery, the workup should involve coronary angiography, and if the patient has triple vessel disease warranting coronary bypass surgery, that too can be done during open heart surgery. That is a synopsis of severe aortic stenosis. Thank you.